Hello, and welcome to today's presentation for Why Healthy Bones Matter for People Living with Breast Cancer. We are so pleased to have you join us today. My name is Ann Marchetti, and I'm the Program Manager for Public Health and Policy here at the Bone Health and Osteoporosis Foundation. While everyone settles into the webinar, I'd like to cover a few housekeeping notes to help the webinar run smoothly. There are several of my colleagues assisting during this webinar to address as many questions as possible. We kindly ask that you post your questions in the Q&A feature. If you don't receive an immediate response, Susan, our speaker today, will likely address your question at some point during the presentation or during the Q&A. We'll also be posting links to program materials in the chat, so be sure to locate that feature. This webinar is being recorded and a replay link will be emailed about 24 hours after today's event, along with the slides and links mentioned during the program. We hope you were able to take the pre-event knowledge survey, and we appreciate your time in completing that short survey. So it looks like everyone is in the room now. And I'd like to introduce today our speaker. Her name is Suzanne Meckler. Suzanne is a trained peer educator, and she volunteers to educate communities about bone health. We appreciate our volunteers and value their expertise and commitment to bone health education. So Susan, I'll let you take it away.
Thank you, Ann. And
you.
one thing I'd just like to let you know is I'm very passionate about this topic. You know, I am here to support and educate my family, my friends, and all of you in this very important topic to assist you on your wellness journey. And my wonderful employer, TGH, has given me the opportunity to follow my passion in being able to present today's event. So I am going to just mention this disclaimer, just taking a moment to review health-related information that is on this slide. The medical information that we share in this program is provided as an informational resource only and is not to be used or relied on for any diagnostic or treatment purposes. We urge you to consult your healthcare provider before making any healthcare decisions or for guidance about anything like a specific medical condition. Also, the nutritional recommendations of this program are based on general guidelines on the United States recommended daily allowances and for people who are in average good health. If you are living with breast cancer, we always recommend to consult with a registered dietitian, possibly a bone health specialist, for any of your individual nutritional requirements. And believes that everyone should have a personalized plan. And this understanding your personal fracture risk factors, knowing your 10-year fracture risk by using the Bone Health and Osteoporosis Foundation Fracture Risk Calculator. And this was developed by American Bone Health. Talking to your healthcare provider about your osteoporosis risk factors and getting a bone density test if necessary, and then determining which, if any, risk factors need to be addressed. The talking with your healthcare provider provided in the related content will help you prepare for that discussion. And certainly some points, being active, getting appropriate physical activity by practicing bone-safe exercises and proper body mechanics. I'm also going to put a little plug in for the other foundational programs, Posture Power and Stepping Out Strong. I'll throw in a little plug for them. Also, eating well by including a variety of bone-healthy, bone-building nutrition. preventing falls by taking steps to improve your balance, strength, and adjusting your living environment, and taking medication if your healthcare provider determines that it is necessary. So we want to emphasize that it's very important to work with your healthcare providers and your healthcare team in general to determine the best course of action so that you can make the best choices as your healthcare team because you are the quarterback. We want to spend a few moments to learn. Please take time and spend a few moments to learn your 10-year risk fracture by using I'm going to call it the BHOF fracture risk calculator, and a link is provided for you. So what we will cover by the end of this program, we hope that you'll understand a few points: the connection between breast cancer and bone health, what you need to know about bones and what can weaken them, how to evaluate your bone health, how to take care of your bones, and how to build your personal bone health plan to protect and keep your bones strong. Throughout this program, we're going to be providing downloadable handouts and materials that Ann had mentioned in the beginning. So we are going to be taking a poll in a moment. So before we get started, it would be very helpful for me to know how breast cancer has touched your life. We have activated a poll, so if you could please select from the choices to answer this question. Your answers will be anonymous. Some of the questions might be: I have been diagnosed, I have a family member, I have a close friend, I am a caregiver, or none of the above. Okay, and as you can see from the poll, the highest percentage of those of you who are attending today have been diagnosed with breast cancer. The next highest percentage is having a family member, like I do. And then the next, of course, is having a close friend, being a caregiver. And there's a few of you who are on here just probably finding out some information. So we appreciate all of you who are attending today. So let's move on. We're going to talk about what the connections are between breast cancer and bone health. So we want to begin by understanding what those connections are. As you are likely aware, breast cancer is unfortunately a very common disease that affects 1 in 8 women in the United States and is the second most common cancer in women. However, it can also impact men. Osteoporosis is also a common disease. In fact, 1 out of 2 women and 1 out of 4 men over the age of 50 will break a bone due to osteoporosis or decreased bone density. For both conditions, breast cancer and osteoporosis, that risk increases with age. The risk of breast cancer is especially high when a person reaches 60 years old or older, and women in this age group are also at increased risk of developing osteoporosis. If you have breast cancer, your risk of osteoporosis may indeed be increased. So we do have a handout for you, which will be in the chat. So how does breast cancer impact our bones? Thanks to effective medical treatments for breast cancer, survivors are expected to live longer, and that is so great. It's important to know, though, that breast cancer and some breast cancer treatments, unfortunately, also could put you at a risk for osteoporosis and bone fractures, even if you are under the age of 60. So having too much calcium in the blood can also be a concern with breast cancer. Cancer cells release a hormone that can speed up the rate at which bones release calcium, which is known as hypercalcemia. Fortunately, this can be treated. Other ways that bones may be impacted when you have breast cancer are what's called osteonecrosis of the jaw, especially if the breast cancer itself has spread to the bones. For those of you who may not be familiar with this condition and this term, osteochronosis of the jaw, or ONJ as it is called, is a rare dental condition found mostly among cancer patients. ONJ occurs most often after a major dental procedure in which the bone in the jaw does not heal after about 8 weeks of appropriate dental care. While there's no definitive proof, there are links between ONJ and cancer patients treated with high doses of intravenous bisphosphonates, most often with pamidronic acid and zoledronic acid. These medicines are used to help to prevent that cancer-related breakdown of the bone. So maintaining strong bone health is crucial to improve one's life with breast cancer, no matter what age. There is much that you can do to keep your bones as strong as possible, so let's learn how. So the fact is that bones are living tissue. So we want to learn more about bones, that bone mineral density, and the connection with osteoporosis. So it's always been kind of easy to think of bone as a hard, lifeless part of our body. But the fact is that bone is living, growing tissue, with old bone being removed and replaced with new bone. Because of this process called remodeling, where the cells that are called osteoclasts break down bone, and the other cells involved, called osteoblasts, build bone. The bones that you have now are not the same bones that you had 7 to 10 years ago. And they will not be the same bones that you will have in 7 to 10 years. So that's really kind of good to know, because this gives you the possibility and the opportunity to improve your bones. In healthy bones, the osteoclast and the osteoblast activity is balanced. When this remodeling becomes unbalanced, in other words, when removing bone happens faster than replacing bone, bones can become quite thin and fragile. So throughout our life cycle, bones are built, broken down, and then rebuilt. And this is referred to the life cycle of the skeleton. Bone is living tissue. To keep bone strong, your body breaks down old bone and replaces it with new bone. Throughout childhood, the osteoblasts, those are again, the bone forming cells, are working faster than the osteoclasts, the cells that are breaking down bone. The skeleton grows very rapidly during our teenage years until peak bone mass is reached at about age 30. Once you reach peak bone mass, the remodeling process stays balanced. The osteoblasts and osteoclasts are kind of working at the same pace, and our bone mass stays relatively stable until about menopause for women and about age 70 for men. At menopause, because of the decrease in estrogen, the osteoblasts do not keep up with the osteoclasts, and there's a rapid period of bone loss, as you can see on the slide. You notice there that peak point at 30, and then that decline as we go on through the aging cycle. So during the 5 years around menopause, women can lose as much as 15 to 20% of their bone mass. The average age of natural menopause is 51. Some women may go through menopause earlier in life, could be due to several things such as surgery or medical treatments, including some breast cancer treatments, and are subject to the same bone loss issues as women going through natural menopause. Men continue to lose bone density at a steady but slower rate than women, and at about age 70, where the reduction of their hormone levels begins to cause more rapid bone loss. So understanding how bone develops helps us understand how we can prevent osteoporosis and fractures. There are many very important things that we can do to support our skeleton over the course of our lives. especially children, kids need to build as much bone density as they possibly can in their teens, because the years around puberty, about 9 to 14, we will build the most bone density than we will lose in the entire lifetime. So today we're going to talk more about what we can do to help optimize and preserve bone density and kind of limit lifestyle behaviors that are not good for bones. So osteoporosis is a silent disease. When bones of the skeleton lose their mineral density, the structure becomes thin and unable to maintain our normal weight, leaving bones that can break quite easily. Notice the density difference on the slide there. The healthy bone, which is on the left, is the strong bone. It protects, it holds up, it protects our body organs, it maintains our posture. And when muscles contract and relax, the bones help us move around. You can see the bone on the right is significantly thinner and not even connected at certain places. So this opening, and this can happen just from opening a window where a bone can break with very little impact. We frequently hear about people sneezing, breaking a bone, or reaching for something in a cabinet, and unfortunately hearing an awful bone pop. So if you're comparing the two pictures, you can kind of see why this would happen. Oftentimes people confuse osteoarthritis, and that's inflammation in the joints, and osteoporosis, which means thinning bones themselves. People with osteoarthritis, especially in the joints, will definitely have pain, and I can attest to that. Osteoporosis is a silent disease and maybe not always having pain, but the pain will happen as a result of the fracture. So which bones are most commonly affected? When our bones are weak, they break easily, and it can happen just by bumping into something or falling. Often the first break is the wrist fracture from falling. The most common bones that break due to osteoporosis, in addition to the wrist, are the upper arm near the shoulder, the hip, and spinal bones. And so bones should not break kind of almost spontaneously when we fall, and especially if we might fall from a standing height. You can feel your bones. You can't really feel your bones getting weaker. So it's really important to know what our risk factors are for making them weak. So we're going to take a close look at these risk factors. So let's look at this overview on factors that impact bone health and increase risk for osteoporosis. As you can see, there are several risk factors for osteoporosis, and some of them we can't change, including breast cancer, and unfortunately some of the treatments. Gender is one. 80% of people who have osteoporosis are women. Women have a higher risk of osteoporosis than men due to those low estrogen levels that can happen as we age. Genetics, about 65% of bone health can be attributed to genetics. So if one of your parents had osteoporosis, you are at greater risk for yourself. Age. As we age, our risk increases. This is considered primary osteoporosis, age-related. Fracture history, yours or your parents. And if you have a low impact fracture, your chance of having another fracture increases. And finally, medical conditions and medicines. There are a number of medical conditions and medicines that can affect the bones, in addition to just the breast cancer and its treatments itself. We can't do much about some of these risk factors, but it's important that we are aware of them so we can take steps and measures to minimize their impact. So the great news is that there are a number of factors or things that we are able to control. And some of these ways include reducing these risk factors. Stop smoking. I cannot emphasize that enough. Or vaping. Neither one do anything good for you. And there's a lot of programs out. If you are smoking or vaping now, please consider attending a program to learn how to stop doing that. That was probably one of the best things I ever quit in my life. Eating 3 to 4 servings of calcium-rich foods a day. Limiting alcohol to 1 drink a day. Increasing physical activity, especially weight-bearing activity and weight-bearing exercises, including strength and bone-building exercises. Improving your posture, number 1 on the hit parade. Doing what you can do to make sure your body weight is appropriate. Talking to your doctor about the right amounts of vitamin D or calcium as needed. You can have that done by a blood test. Assessing your fall risk and work to make improvements if needed. And talking to your healthcare provider about the medicines you take and their impact on your bones. So breast cancer treatments can unfortunately weaken our bones. So let's start looking at some of these treatments that can impact our bone health. The first 2 medicines are aromatase inhibitors and steroids. Aromatase inhibitors can cause bone loss and increase the risk for fractures. You can see on the screen which medicines are the aromatase inhibitors. You may want to write a few of these down if you know you're already taking these, and certainly ask your physician whether you are taking these or ask them about these. The steroids, which are often prescribed along with chemotherapy, unfortunately have often also been associated with bone loss. So taking into consideration that these, while these life-saving treatments are crucial, bone density and risk fracture also needs to be evaluated if you or a loved one is taking one or any of these medication or has even taken them in the past. Talk to your healthcare provider about what you can do to manage your bone health if you are taking these medications. So treatments that can block estrogen production or cause menopause. Other treatments that can negatively impact bone health include hormone therapy, ovarian suppression, and chemotherapy. In a study that looked at bone loss in breast cancer survivors, women with estrogen receptor positive ER plus tumors had a 2-fold risk of low bone mass and osteoporosis, and that can be unfortunately attributed to the hormone therapy itself. The ovaries are the main source of estrogen in premenopausal women. Some treatments for hormone-sensitive breast cancer work by stopping or blocking the function of the ovaries to prevent the production of estrogen and the growth of those breast cancer tumors. This is known as ovarian suppression therapy. Another form of treatment is to surgically remove the ovaries, which results in early menopause. A downside to these treatments is that the low or complete lack of estrogen can then lead to a higher risk of bone loss and fractures right away. So tamoxifen is a hormone therapy that keeps estrogen from connecting to the cancer cells to prevent them from growing and dividing, which has been associated with bone loss in premenopausal women. Chemotherapy drugs for treating breast cancer can also cause early menopause and has been associated with lower bone mineral density. So then, thinking of radiation treatment, we know that that can be kind of a regular part of the protocol. So in addition to the previous breast cancer treatments that can affect bone, in rare cases, external beam radiation treatment for breast cancer may then internally weaken the ribs, which could then lead to a fracture. So then medicines, let's look at some of these that can cause bone loss. There are many other medications that can cause bone loss as a side effect, in addition to to breast cancer treatments that we covered. So this is just a snapshot, and I'd like for you to please look at some of these. And if you are taking any of them, write them down and have a discussion with your doctor about this. So if you are currently taking any of these or might be looking to take a new medication, please talk to your doctor, even your pharmacist, about how these may affect your bone health. So, other conditions that can cause bone loss. It's important to know that there are many other medical conditions, and then, of course, the corresponding medications to treat them that could lead to bone loss. This is a list of the most common conditions that can cause bone loss. I will not read them all, but please take a moment to look at these and see if you have any of these other conditions. And that, again, this would be a discussion. You're going to learn a lot of information today. So this would be another discussion to have with your healthcare provider, especially if you have things like Cushing's disease, which is when the body produces too much of the hormone cortisol, many eating disorders because you're not getting the nutrition that you need, and even something like rheumatoid arthritis, because the risk for osteoporosis and the risk of fracture increases because of the inflammation that creates that bone damage. So any of these, please take a moment, write them down, and then consult with your doctor about that. So now let's talk about evaluating the health of our bones. So we've talked about the risk factors for weakened bones. So how can we, as an educated patient, evaluate the health of our bones? We firstly, again, our healthcare provider is our advisor. We want to consult with them or someone else on our healthcare team and get a blood test to measure the levels of vitamin D and calcium in your body. I do that all the time. If your levels are low, your healthcare provider can discuss the supplementation and give you a good idea about how much. Sometimes we try to do this on our own and we don't really know what might be good for us. So ask your healthcare provider for a bone mineral density test if you have not done one already. So we're going to have another quick poll, and we're going to ask you about if you've had a bone density test, where you lay on the table. And it's going to be pretty quick. It's just going to be pretty much a yes or a no. Okay, so we see the majority of you have had this done, which is wonderful. And for those of you who have not, maybe by watching this webinar today, might encourage you to ask to have it done. So in addition to bone mineral density, it's important to understand your fracture risk as well. What we know from the National Osteoporosis Risk Assessment, called the NORA, N-O-R-A, a longitudinal observation study, is that fractures happen at all bone densities. Bone density accounts for only about, as you notice in that little orange circle, only accounts for about 30 to 50% of fracture risk. The majority of fragility fractures actually occur in people without osteoporosis, as defined by bone mineral density, or BMD. We're going to learn, we're going to cover this in a moment. So we've already covered the factors that are part of the risk equation, which include age, race, gender, bone mass index, medical conditions and medicine, lifestyle, and fracture history, including yours and your parents. Breast cancer and some of its treatments may be part of the risk equation for you. So we'll talk more about fracture risk after we review what a bone mineral density test actually is. So this is how we learn what our bone mineral density actually is. You certainly can ask your healthcare provider for bone mineral density test if you have not had one done already. Many times they will, be proactive and say they want you to have it done. This is the gold standard for screening and diagnosis of osteoporosis, and it's called DXA. This is short for X-ray technology called dual energy X-ray absorptiometry. This is also referred to as a bone mineral density test or bone density test. This test measures the amount of bone density usually taken in the spine and the hip. It's simple and painless and maybe takes about 15 minutes. As long as you're not wearing any kind of metal, like a zipper or an underwire bra, you can keep your clothes on. You will need to lay face up on a padded table as the arm of the scanner passes over you. The scanner uses a very small X-ray beam to capture images of the bones in your lower back and hip. It uses about 1/10 of the radiation of a chest X-ray. So that's less radiation than you'd be exposed to on a coast-to-coast flight. So NCCN, the National Comprehensive Cancer Network, has guidelines that recommend getting a base DEXA, that's what we kind of call it, before starting treatments for breast cancer. If you have breast cancer, ask your healthcare provider if you should have this bone density test. If you are taking medications that can weaken your bones, or conversely, are taking medicines that can strengthen your bones, your healthcare provider may order these DEXAs every 1 to 2 years to assess any changes in your bone density. May I say that this is one of the most important steps that can help to ensure that bone health will be properly assessed and monitored throughout the treatment for breast cancer, and then, of course, afterwards. So I don't know about you, but if you've had one done, you might not understand what the results mean, but I'm going to take a few minutes and explain it to you in a little bit more detail. So when you get this bone density test, the results are reported as a T-score. That's a statistical measurement. The T-score tells you how your bone compares to a healthy person at peak bone mass at age 30. The Z-score compares your bone density to the average bone density of people your own age and gender. So a T-score is reported as a standard deviation, which tells how far you are from zero. A standard deviation is 10% and is used to describe the ranges for many tests. So just for an example, if your T-score is between negative 1.0 or greater, it's classified as normal bone density. If the T-score is between negative 1.0 and negative 2.5, it is classified as low bone density, and that would be considered osteopenia. If the T-score is negative 2.5 or lower, then it is classified as osteoporosis. So there is a link on the website for more information about your T-score and your Z-score, and I believe these will be in the chat. So bone density is only one part of your full bone health picture. If you have broken a bone and have a T-score that indicates low bone density, you can still be at increased risk for future fractures. It's important to ask for and keep a copy of your bone density tests. If you want to be able to compare your results when you have follow-up tests, and if possible, take follow-up DEXA tests on the same machine. Take your DEXA results with you to each doctor's visit. Now, I will interject that there are some, I have my chart So I have all my lab results on there, and I tell you, it's wonderful because then the doctor can see it immediately, and that helps us. So there are a lot of electronic ways to be able to keep track of your test results too. There is also an additional software program called TBS, or Trabecular Bone Score, and that is available on some DEXA machines that gives a reading of bone quality or bone strength. So this way you can ask the facility that you go to that performs your test if it indeed has TBS software and find out if you need an additional written prescription for your physician. So estimating our risk of fracture, we've been talking a bit about this already. So to further your understanding about bone mineral density, let's talk about how you can learn about your risk of a fracture. So if you are 45 years or older, you can learn your risk of breaking a bone by using the BHOF Fracture Risk Calculator. This online tool generates a risk level based on your age, your BMI, your bone density, and T-score, if known, and medical conditions. So it'll ask you a variety of questions. These are the risk factors you have learned about during this program already. So please be sure to take some time after this presentation. We urge you, if you have not done so already, to complete the fracture risk calculator. So that will also be in the chat. We'll include a link to the fracture risk calculator in our follow-up email after this talk as well. So please keep in mind, the fracture risk calculator is not intended to provide an estimate of risk of fracture from cancer that has spread to the bones. So what can we do to protect and keep our bones strong? So we've learned a lot about osteoporosis, low bone mass, and risk factors for fractures. Boy, that's hard to say. So let's talk about what you can do. And we're talking now about lifestyle to take care of your bones and to prevent bone loss. So let's think about these 4 points that are up here. We need to think about having good nutrition with adequate calcium, vitamin D, magnesium, and protein. Good posture. I cannot say enough about how important good posture is, and physical activity to keep our bones strong. To take precautions to prevent falls and reduce fractures. And bone strengthening medicines if recommended by your healthcare provider. So we won't have time to talk about all of these in great depth, but as I've mentioned earlier, there are other programs from BHOF that will go into some of these a little bit deeper for you. And some of those programs, the nutrition side is eating for healthy bones. And as I mentioned earlier, the physical activity one, stepping out strong, posture power, and freedom from fractures. So these are all different webinars and so forth that are available. So let's zero in a little bit on that good nutrition. So and I will tell you, no matter who we are, no matter what we have, good nutrition is the foundation of overall good health. And calcium in particular, for what we're talking about today, is the principal mineral in bones. Not only what it makes, that it makes our bones strong, but also the nerves and the muscles. There are many other tissues in the body that need calcium to function. And if calcium is not found, if there's not enough calcium found in the bloodstream, unfortunately, the body will take calcium from the bones. So to maintain a good level of calcium in the blood, we need to take between 1,000 and 1,300 milligrams every day. This equals about 2 to 3 servings of a calcium-rich food. So the best source of calcium is dairy. So in general, you get about 300 milligrams of calcium in a serving of dairy or a calcium fortified food or juice. Unfortunately, many people are lactose intolerant and need to find other ways to get calcium. There is some calcium in vegetables, but the amount is kind of small, as you can see on the slide there. And you must be aware that calcium does bind to the fiber in the vegetables and is not always easily absorbed. So you also want to pay attention to food labels and look for foods that include calcium or might be calcium enriched. Like if you're lactose intolerant, you're using one of the other milk products, the substitute, whether it be the nut milks or something like that, check the labels to make sure that you're getting enough calcium. So be aware of how much calcium you need to eat every day. Remember, we're talking about 2 to 3 servings of calcium-rich foods that should help you meet your daily requirement. And this would be something like an 8-ounce glass of milk, 6 ounces of yogurt, 2 to 3 ounces of cheese is about 1,000 to 1,300 milligrams of calcium. And if you cannot meet your daily amount required through your food, you might need to get a supplement. But again, this is where you'd want to talk to your physician, or if you're seeing a registered dietitian, to really get the best numbers for you to be taking. So if you do need a calcium supplement, if you do not get enough calcium in your food, again, you may need a supplement. So remember, your total calcium intake should be calculated from food plus supplements. You want to start with small doses if you are prone to constipation or stomach upset. And again, be sure to ask your healthcare provider about how much you should need. You can have that blood test done, and that will really kind of zero in on how much you might be needing. So firstly, you want to start by calculating how many servings of calcium-rich food you do get in a day, and then only add a supplement to get you to your recommended daily allowance, otherwise known as the RDA. There is no additional benefit of going beyond the RDA. If you're going to take a supplement, know that there are 2 basic types of calcium. There are, in the supplements, there's calcium citrate and calcium carbonate. Calcium citrate is more soluble. You can take it without food. So again, be sure to read the labels. You might have to take more tablets to get the right amount of calcium. Calcium carbonate needs the acid in your stomach to actually help dissolve the tablet. So always take it after you have had food in your stomach. So the acids are kind of churning away. Consider taking a calcium supplement that includes vitamin D. We're going to talk about that in a moment. Be sure to read the supplement labels. Some of the supplements contain vitamin K, and you don't want that if you are on a blood thinner like Coumadin. That happened to my mother. Don't take them with iron supplements like your multivitamin. The 2 compete for absorption in your body. So if you take thyroid medication or a beta blocker, be sure to discuss your calcium intake with your doctor. Remember, the body can only absorb about 500 to 600 milligrams of calcium at a time. So read the label and don't take more than 500 or 600 milligrams at one time, because the rest is not going to be absorbed. So now let's zero in on vitamin D. As mentioned earlier, vitamin D, calcium needs vitamin D in order to be absorbed in the intestines. If you're taking a calcium supplement, you want to make sure it includes vitamin D. And although vitamin D can be made in the skin when we're exposed to sunshine, the sun is not a reliable source of vitamin D for most people, and there's really no way to actually measure that. To maintain a good level of vitamin D, people need anywhere from 15 to 50 micrograms or 600 to 2,000 international units, that's the IUs, a day. For healthy adults, the National Academy of Medicine suggests about 15 to 20 micrograms or 600 to 800 IUs. However, if you have a metabolic bone disease such as osteoporosis, the Endocrine Society suggests an even higher level, up to 50 micrograms or 2,000 IUs per day. There are several food sources of vitamin D, particularly the fatty fish, but most people need to take a vitamin D supplement. And you can see on the slide, again, some of the foods that contain that would be salmon, sardines, trout, dairy, such as milk, fortified with vitamin D, other foods like fortified cereals and juices and some of those milk substitutes, and protein, such as in the egg yolk. But notice there are no fruits and vegetables on this list. Remember to talk to your healthcare provider about how much vitamin D you should be getting. There is a handout that will be in your in the chat. It's called the Dynamic Duo, Calcium and Vitamin D for Bone Health, for further information. And also, please read the handout that is included, Bone Sense on Nutrients for Bone Health, which covers some of the additional bone nutrients. Here we go, talking about posture. So let me tell you just how important posture is for your bones. The spine is a common place for osteoporosis or weakened bones. So it's important to support your spinal bones to protect them. There are simple things that you can do. Firstly, always think about using great posture and great body mechanics, even when you're doing some simple daily activities, and especially when you're doing exercise. You want to make sure to keep your back straight. You want to make sure that you bend at the knees. And hinging at the hips, some people don't really understand what that means, but hinging at the hips means that you keep your upper body straight and you kind of bend only at the hip area. Too many people with poor posture will lead with the upper body. So hinging at the hips means that you keep that upper body intact and then you just move forward. Let the whole upper body move forward at the hip line instead of, using again that upper body. Stretching the muscles in the chest, strengthening the corresponding muscles in the back between your shoulders. These can certainly help to protect your spine. And finally, good core strength can also help to protect the spine. And the core muscles include all those muscles in the mid body, especially the ones that are for the spine, keep the spine tall, and also your abdominal muscles. So, and they have found the research that it can be kind of tricky because we've always thought that sit-ups are always a good option. But in fact, they have found that crunches can cause a lot of damage, that forward curling. Plus, if we already have the poor posture, you don't want to encourage that. So that the crunches, that forward curling is not really one of the best exercises to do. However, we do have one exercise that really covers the gamut and makes all of those core muscles work together. And this is called the plank. So even when it's done on your knees, it can help to build that core strength because all of the muscles are involved. So you see on this next slide, improving your posture. We spend a lot of time in our high-tech world hunched over our devices, hunched over our desks, over our steering wheels, and even, hovering over counters. So this exercise that's here, that's shown, can help to improve your posture by strengthening your back muscles and expanding your chest muscles at the same time. So you want to put your arms up in a W. You want to have a nice alignment with the wrists and the elbows and the shoulders. So you want those hands to be parallel. and kind of what you would think of as like a W form. You want to then pull the arms back by squeezing your shoulder blades, and exhaling is a great way to do that. And then you can feel those muscles in the back pulling together. And then release, just hold for a few seconds and then inhale and just let them return to your side. You don't want to bring them all the way forward, but just to your side. We want to focus more on those back muscles and strengthening them. And this, you can do this whenever, and especially if you've been sitting at a desk for a long period of time, maybe every 60 minutes, get up and do something like this to help to correct that posture that you've been having. So this will definitely help to improve your posture and help you maintain good body mechanics. And again, I defer to Posture Power. I think that would be good for you to look at. All right, so continuing on, talking about physical activity. So we want to talk about loading that is required for bone building. So physical activity in and of itself is very important for our bones. And, as I've mentioned, for your overall health. Physical activity should be done at a level that's appropriate for you. You don't want to try and do everything at all one time. You want to give your body a chance to adapt properly. Everyone is at different fitness levels and energy levels. And you always want to consult, again, we say this over and over, consult with your healthcare provider before maybe even starting a physical activity program, increasing your activity levels, or then trying to do some new exercises to introduce them. To stimulate bone building physical activities, they need to be what's called weight bearing, which means pretty much standing up to do them. I call that sturdy stancing. And the higher the load, the better. So to build bone density, you need to do activities that load the bones with what's called 4.2 times your body weight. This is called osteogenic loading. And this is the amount of force needed to stimulate the osteoblasts to build bone. So basically, you can remember that activities that are strengthening your muscles are going to then turn and strengthen your bones. The loads on the skeleton are going to vary by exercise. So our next slide, we're going to take a look at what that means. So the load that you put on your bones, again, varies by the type of activity that you're doing. And we think about load as multiples of body weight. The more body weight or load involved in activity, the bigger, better effect on the bone density. The numbers on the left that you see are the numbers that you see on the left represent the load on the body and the bones. So when you swim or cycle, there's not really a lot of body weight or gravity added to load your bones. Yes, those are very important strength, but they don't really put that weight-bearing effect on the bones. Walking, very simple activity to do. Brisk walking loads 1 to 2 times the body weight and can help prevent bone loss. Plus, there's a balance component to that as well. If you run, jog, jump, the greater impact with the ground loads 3 times your body weight. And that because we get a reaction when we kind of stamp on the ground or touch the ground. To build bone density, you need loads of at least 4 times your body weight. And you can get this by jumping. Doesn't have to be big, giant jumping, but you can do just small little jumps like this, where you're just lifting your heels up and just gently tapping the ground. That will help to increase your bone density. You can get this, and you can also do strength training, which also loads your bones in a different way. So before you start jumping, though, may I say, please, again, check with your healthcare provider, or if you are seeing a physical therapist, which might be a very good way to start your exercise program, to determine whether jumping is appropriate for you based on your fall risk or bone density. And they may say, well, yeah, you can jump just a little bit, but not, big giant, leaping over things and things like that, leaping over houses with a single bound. We have another handout available for you titled Bone Sense on osteogenic loading. And the link to this resource is available in the chat. Okay, so let's talk about balance. Balance is so important for our health overall, mental health, emotional health, and being able to get around without fear of falling. So if you have good balance, you're less likely to fall and you're going to be very confident. So those things are very important. So did you know that balance can be improved with practice? Practice makes perfect, as they say. So balance is something you can practice every day. So you can start by doing something small, where a small static balance activity. Like you see the woman on the slide, she's lifting her leg and she's holding that position. That's considered static. Balancing on one foot. And you can begin by, if you can't lift your foot all the way up like she did, you begin just lifting the heel up and let that body weight just shift over to the other side. You can do this while you're brushing your teeth so that you start to kind of practice some activities, and you want this now balance to become a habit without even thinking about it. You want your body to automatically kind of go into that habit. And you will guarantee you'll notice a big change in a short period of time. There's other ways to be able to do that. You can hold by holding onto a counter or standing on one leg as well. So how to prevent falls at home? There are many things you can do to prevent falls at home. Let's focus on a few of these. You check your stair carpet. Is it loose or torn? Does it have too much paddings? That's difficult to feel the front edge of the stair. Make sure the carpet is firmly attached to every step, or remove the carpet and attach non-slip rubber treads to the stairs. Throw rugs are one of the most common causes of falls in the home. And you want to notice that bedroom is not on this slide, but it's still very important. So after this event, you want to look at your bedroom and consider ways that you can improve trip hazards. And here are some suggestions: putting a night light, night switches close to the bed, keep a flashlight by your bed in case the power goes out and you need to get up and go to the bathroom, keep your phone by your bed. So there is a handout for you that's called Ways to Prevent Falls at Home. And then we'll go over some of the medicines. Your healthcare provider may prescribe a medicine to prevent bone loss and fractures if you are on certain breast cancer treatments or at high risk of fracture. If a doctor determines that you or a loved one needs a medication to prevent bone loss or fractures, there are many that are available. Bisphosphonates and rank ligand inhibitors are two classes of medicines that are commonly used for treating and preventing osteoporosis. Many of you may have heard of these already. They also have been shown to be effective to maintain or improve bone mineral density and reduce the risk of fractures in postmenopausal women taking an aromatase inhibitor. They work by decreasing the amount of bone that is broken down, and is called an anti-resorbative medicine. One medicine that's called denosumab is taken by injection at a medical office 2 or more times a year. The brand name is Prolia. It's very important not to stop taking this medication without starting a bisphosphonatic. Stopping denosumab can cause rapid bone loss that has been shown to increase the risk of broken bones in the spine. If a doctor tells you to stop taking that, be sure to ask about starting a bisphosphonate. Okay, so we've mentioned this periodically throughout this presentation. It's very important that you take care of your bones and have a good relationship with your healthcare provider. You want to speak to them about what you can do. You want to be proactive yourself. Keep your bones strong. Be sure to ask your healthcare provider or oncologist about getting that bone mineral density test. It's best to get that baseline bone mineral test prior to starting treatment with the medications that can weaken the bones. It's also recommended that if you're taking treatments that weaken the bones. You have a bone density test every 1 to 2 years during the treatment to monitor your bone health over time. Talk to your healthcare provider about getting those levels of vitamin D and calcium, figuring out how much you should be taking. If your levels are low, discuss about taking a supplement, the calcium and vitamin D. Be aware of any exercises or physical activities that you should avoid so that you know. There are high risk factors for fractures. Discuss whether you need a bone strengthening medicine. If you notice any bone pain or other symptoms that worry you, be sure to let your healthcare provider know. Okay, and so to recap, today's presentation was a lot of action-packed and info-packed for sure. We've covered a lot of information today, and I hope that you now understand how breast cancer and some of its treatments can impact your bone health, as well as other factors that impact your bones. The good news is that there are steps that you can take to prevent and keep your bones as strong as possible. As we mentioned, it's important to be proactive and discuss your bone health and your health with your healthcare providers, and that your bone health to be assessed and that you have a self-management plan. Finally, putting your own bone health plan together and implementing it will help you be able to continue to do the things that you love to do and have joy de vivre in your life. Okay, so staying connected, stay in touch for the most up-to-date information by signing up for the newsletter, connecting with our organization on Facebook or Instagram, or just emailing info@bonehealthandosteoporosis.org. As part of a bone health plan, we recommend that everyone know their risk factor. To determine your personal risk factor, please go to the link provided. Thank you again for taking the time for watching this program. Please help end fractures and osteoporosis as a major health problem. Thank you. And so
Thank you. Yeah, thank you so much, Susan. This was terrific. I appreciate all your tips. Every time I hear a presentation, I always learn a couple new things. So today was no exception to that. We've had a few questions, and it looks like the moderators have answered most of them. I just wanted to point out that there is a lot of information in this presentation, and we just touch on very, very briefly, not even the tip of the iceberg. So, you know, if you want to learn more, we probably have a program on that. Susan mentioned the nutrition and the other exercise programs, and we're always doing specialty programs delivered by bone health experts in the field. So be sure to check out the events page. And there was just two quick questions. I know we're at time, but I wanted to make sure that we cover them to see. Someone was asking about the DEXA test. They seem only as good as the machine and the way a person is lying down. If there is a variation from test to test, how valid do you think the DEXA actually is?
As far as I know, it is a very valid test. And I think I mentioned earlier that you want to go, if you possibly can go to the same machine or the same place to do it each time that you do it. I think you'll be able to get consistent results. But if that's a question that you have, you may want to ask your healthcare provider or oncologist and say, you know, I'm concerned. Do you have, and let them also give you some information about that too. Good.
Yeah, and DEXA tests really are the gold standard for screening and diagnosis for bone mineral density. And with any test, it has to do with the person who's performing the test. So you want to make sure that you're comfortable with the facility that you're using, and you know that they truly are certified bone densitometrists. The other question is, and this might have to go back to the healthcare provider, but the infused meds have a side effect of broken bones. Who do I consult with to develop a plan to address bone loss without these drugs? Yeah.
That would definitely be a question for the physician for sure.
And so we'll go ahead, we need to wrap up here, but we'll go ahead and make sure you check your email tomorrow. There will be all the links, including to the fracture risk calculator, and there'll be other information there that talks about fracture risk. So please watch for that. And if there's anything else we can help you with, please be sure to contact Bone Health and Osteoporosis Foundation at info@bonehealthandosteoporosis.org. So thank you for joining us, and I hope everyone has a great day. Thanks, Susan.
Oh, you're welcome. My pleasure, as always.
Yep. Thank you.
Bye-bye.
Bye-bye.